Two cases I've reported on this year touched me deeply, in part because both involved people with mental health disorders, and in part because mental health illness runs in my family, as it does in many families. One was about 15-year-old Seth Johnson. His grandmother had called deputies to help her get him to a hospital, but he had a knife. He wouldn't put it down, and he lunged toward a deputy, and he was shot and killed. His grandmother was struggling to find help for him, and the day after he was killed, he was supposed to have an appointment to start a home-based mental health program. The help for Seth came too late. The other was about Anthony Moody. He had been in a mental hospital for 2 weeks. He'd been discharged. He'd only been home a couple of days. When his mother noticed that something just didn't seem right, he'd become very paranoid. She took him to a local hospital, and they deemed him to be stable and released him. The next day, he stole a small sledgehammer and robbed a pawn shop of a gun and was shot at by police and pawn shop workers. But the help didn't come for him either. I hope both these stories raise awareness of mental illness, inadequate bed space, inadequate treatment programs, slowness to get help. These are problems that affect many families, although people just don't like to talk about it. But I hope this raises a lot of awareness and leads people to support improvements in our mental health system.